High blood sugar, also known as hyperglycemia, is a condition that arises when there is an excess of glucose in the bloodstream. While many people are aware of the association between high blood sugar and diabetes, it's crucial to recognize the early signs and symptoms that often go unnoticed. Ignoring these signs can lead to serious health complications. Understanding high blood sugar begins with comprehending the role of glucose in the body. Glucose, commonly referred to as blood sugar, is a primary source of energy for cells. It is obtained from the food we consume, especially carbohydrates. Normally, the body regulates blood sugar levels within a specific range. However, when this balance is disrupted and blood sugar levels become elevated, it can lead to hyperglycemia. Several factors contribute to high blood sugar levels. Unhealthy dietary choices, sedentary lifestyles, insulin resistance, and certain medical conditions can all play a role. A diet rich in processed sugars and carbohydrates, combined with a lack of physical activity, can lead to weight gain and insulin resistance. Insulin, a hormone produced by the pancreas, is crucial for regulating blood sugar. When the body becomes resistant to insulin, it can result in elevated blood sugar levels. Number 1. Slow healing of wounds. High blood sugar can affect the circulatory system, leading to reduced blood flow to various tissues. This compromised blood flow means that essential nutrients and oxygen required for the healing of wounds may not reach the affected areas efficiently. Diabetes can cause damage to the small blood vessels over time, further exacerbating circulation issues. Hyperglycemia can impair the function of immune cells responsible for fighting infection and promoting healing. This weakened immune response can result in an increased susceptibility to infections and wounds, hindering the overall healing timeline. Individuals with diabetes or elevated blood sugar levels may notice that cuts, bruises, or injuries take longer to heal than expected. Chronic wounds, such as ulcers on the feet, are particularly common in people with uncontrolled diabetes and can lead to severe complications if not addressed promptly. Number 2. Recurring infections. Hyperglycemia can weaken the body's defense mechanisms in several ways. High blood sugar levels can impair the function of white blood cells, which play a crucial role in identifying and destroying pathogens. Excess glucose in the bloodstream provides a favorable environment for bacteria and fungi to multiply, making infections more likely and harder to combat. Common infections associated with uncontrolled diabetes include urinary tract infections, skin infections, and recurrent yeast infections. Individuals with diabetes may find that they experience infections more frequently, or that these infections are more challenging to treat effectively. The circulatory issues associated with high blood sugar can compromise the delivery of immune cells to infection sites, further hindering the body's ability to mount a robust defense. Number 3. Increased hunger. When blood sugar levels are consistently high, the body may struggle to effectively transport glucose into cells for energy. This cellular resistance to insulin can leave the cells in a state of perceived starvation, despite the abundance of glucose circulating in the bloodstream. As a compensatory mechanism, the body signals a heightened sense of hunger, prompting individuals to eat more in an attempt to meet the perceived energy demand. Insulin resistance can disrupt the normal signaling of hormones, such as leptin, which regulates satiety. As a result, individuals with high blood sugar levels may find it challenging to feel satisfied after meals, contributing to increased overall food intake. This cycle of elevated blood sugar, insulin resistance, and increased hunger can lead to overeating and, consequently, weight gain, a common concern for individuals with uncontrolled diabetes. Number 4. Dry mouth. High blood sugar can lead to a reduction in saliva production, as the salivary glands may not function optimally under conditions of prolonged elevated glucose. Saliva plays a crucial role in maintaining oral health by helping to wash away food particles, neutralize acids, and prevent the growth of harmful bacteria. When saliva production is compromised, these protective mechanisms are hindered, increasing the risk of dental issues such as cavities and gum disease. Individuals with diabetes are more susceptible to fungal infections in the mouth, such as oral thrush, due to the favorable environment created by elevated glucose levels. The combination of reduced saliva flow and compromised immune function can contribute to an overall feeling of dryness and discomfort in the mouth. Dry mouth can also exacerbate other symptoms of high blood sugar, such as an increased risk of bad breath, halitosis, and difficulty swallowing or speaking. Number 5. Frequent urination. Our kidneys play a crucial role in maintaining the balance of fluids in the body, and when blood sugar levels are elevated, it can lead to excessive urination, a condition known as polyuria. The connection between high blood sugar and frequent urination lies in the kidney's response to elevated glucose levels in the bloodstream. Normally, the kidneys act as filters, removing waste products and excess fluids from the blood to form urine. However, when blood sugar is consistently high, the kidneys cannot effectively reabsorb all the glucose, resulting in an increased volume of urine production. As blood sugar rises, the excess glucose spills into the urine, dragging along additional water. This osmotic effect creates an environment where more water is drawn into the urine, leading to larger quantities being expelled from the body. Consequently, individuals with high blood sugar levels may find themselves making more trips to the bathroom than usual. Number 6. Fatigue. Fatigue occurs when the body's cells are unable to efficiently utilize glucose for energy due to insulin resistance or inadequate insulin production. When blood sugar levels are consistently elevated, the cells may struggle to take in glucose from the bloodstream. As a result, the body is deprived of its primary source of energy, leading to a persistent feeling of tiredness and weakness. This fatigue can be particularly noticeable after meals, when blood sugar spikes occur, followed by subsequent crashes. The increased urination associated with high blood sugar can contribute to dehydration, amplifying feelings of fatigue and lethargy. Dehydration affects blood volume, leading to reduced oxygen transport to tissues and organs, further exacerbating the sense of weariness. Number 7. Blurred vision. The eyes are particularly sensitive to changes in blood sugar levels, and when glucose concentrations are elevated, it can lead to alterations in the shape and flexibility of the lens within the eye. High blood sugar can cause the lens to swell, affecting its ability to focus properly. This swelling leads to changes in the curvature of the lens, resulting in blurred or distorted vision. Individuals with uncontrolled diabetes may notice that their vision fluctuates throughout the day, especially after meals when blood sugar levels tend to spike. Prolonged exposure to high blood sugar levels can damage the blood vessels in the retina, a condition known as diabetic retinopathy. This can contribute to additional visual disturbances, including floaters, dark spots, or even a loss of vision in severe cases. Number 8. Numbness and tingling. Numbness and tingling, often referred to as neuropathy, are neurological symptoms that can be indicative of high blood sugar levels. Prolonged hyperglycemia can lead to damage to the nerves throughout the body, particularly in the extremities, such as the hands and feet. The relationship between high blood sugar and neuropathy is complex and multifaceted. Elevated glucose levels can contribute to inflammation and oxidative stress, both of which play a role in nerve damage. Additionally, diabetes-related vascular complications can impair blood flow to the nerves, further exacerbating the risk of neuropathy. The sensation of numbness and tingling often starts gradually and may be accompanied by a burning or prickling feeling. This can be particularly noticeable at night or during periods of extended hyperglycemia. Neuropathy can have a significant impact on daily life, affecting balance, coordination, and the ability to perform fine motor tasks. Number 9. Mood swings. Mood swings, characterized by emotional fluctuations and changes in temperament, can be an under-recognized manifestation of high blood sugar levels. The intricate relationship between glucose regulation and mood stability is influenced by various physiological and psychological factors. When blood sugar levels are consistently elevated, the brain's neurotransmitters, which play a crucial role in regulating mood, may be affected. Additionally, the impact of hyperglycemia on energy levels and overall well-being can contribute to mood disturbances. Fluctuations in blood sugar can lead to irritability, anxiety, and even depressive symptoms. The hormonal imbalances associated with insulin resistance can contribute to mood fluctuations. Insulin resistance can affect the regulation of hormones such as cortisol and serotonin, further influencing emotional well-being. Number 10. Difficulty concentrating. The brain's optimal function relies on a consistent and balanced supply of glucose, and when blood sugar levels are elevated, it can lead to cognitive impairments. Hyperglycemia can affect cognitive function in various ways. Insulin resistance, a common feature of high blood sugar, can impact the brain's ability to utilize glucose for energy. This metabolic disruption can result in reduced cognitive performance, difficulty concentrating, and impaired memory. Fluctuations in blood sugar levels can lead to periods of both hyperglycemia and hypoglycemia, creating an unstable environment for the brain. These fluctuations can contribute to mental fatigue, making it challenging to sustain focus and attention over time. Chronic hyperglycemia has been associated with long-term cognitive decline and an increased risk of conditions like dementia. Managing blood sugar levels effectively is not only crucial for immediate cognitive function, but also for preserving brain health in the long run. It's important to emphasize that experiencing one or more of these signs does not automatically mean a diagnosis of diabetes. However, these signs serve as valuable indicators that warrant further investigation and consultation with healthcare professionals. As we conclude this video, the message is clear: prioritize your health, stay informed about the signs your body may be signaling, and take proactive steps to manage your blood sugar levels. Regular health checkups, a balanced lifestyle, and open communication with healthcare providers are essential elements in the journey toward overall well-being.